came out. I said, oh, you know, we caught you paying. I said, $5.
They paid you $5. Yeah. Well, see, we just don't profit. That's a different. Does that?
Well, sound about John Christmas. Was you need to talk.
They're the ones that gave us $15,000 this year. We got it. It made about 10 laps.
Oh, did it?
Hey, did you call me?
But I mean, it was running good when it rained. So the rain hurt.
Private, yeah, I did. Send me her number code so I can call her.
How you doing?
Right.
Wonderful. Like you always have.
What's her number?
Turn out really well. Thank you. Hey, how you doing?
I'm well. Yes, you are. Yep.
Oh, yeah. Quite a long time. It's mine.
So if you feel more comfortable walking around or whatever, feel free.
Thank you. At that time,
Got to fix my chair.
You don't have anything more for them to have with Tia, who's on the presentation? Got her?
yeah, she's over there somewhere. One looks out of place.
Hey, how you doing? Chair to walk away from. I'm doing good. I have a commissioners meeting. That's where I'm at right now. Do you need me? Guess not.
Down. Yeah. Well, right here. There you go. Yeah, I see it.
They didn't. Will they have it tomorrow? I want to play.
Make you feel taller. It depends on the public participation. DJ said he had to get out here at 6:30. He's got a revival. Said he's got a. It'll barely leave us a quorum because we ain't coming down. It doesn't look like clearance.
Okay, thank you. Yes, ma'am.
Yep. All right, I'll call to order this reconvened meeting of the Scotland County Board of Commissioners. First item on the agenda is the approval of the agenda. Let me make sure we got a quorum. Yeah, we do. Okay.
Mr. Chairman, I offer a motion that we approve the agenda.
Second.
All right, we have a motion and a properly second. All in favor? Aye. Opposed? All right, motion carries. Consent agenda. Within that approval, school use of lottery fund money, there was another request that came with it, which I think Jason put those two on your desk. It's not. It's pass through money from the lottery to the schools, and so it's one of those we don't have a choice in it. We even discussed earlier if we even need to go through this action, but since it's on there, I'll take a motion for the consent agenda.
Offer a motion for consent agenda.
A second.
All right, have a motion and a second. Any more discussion? All in favor?
Aye.
All right, moving right along to I.E. Johnson update.
Okay, I'm going to start giving that update. Most importantly, we are ready to open I.E. Johnson. We're excited about that. And I wanted to bring a date before the commissioners tonight to see if on October 24th, next week, if that would be an agreeable date to have a ribbon cutting for I.E. Johnson. I believe that is Tuesday
What
of
time?
next week. The time is to be determined by you all.
I would think later in the day, just so most of the public could be there.
I do too. And so I didn't know if 4 or 5, 4 o'clock.
Oh, before 4.
Tuesday.
Before 4? 3 o'clock? You said 3? 24.
I'm fine with that.
3 o'clock.
3 o'clock. So
3
that
o'clock.
so that would be October 24th at 3 o'clock. We'll have that ribbon cutting out there. We'll of course get that out to the public. Make sure lots of people know about that. I'll give you a few more updates about I.E. Johnson. We're moving in. Staff are already in the building getting set up. And so we have some technical things that we are still getting set up. like the cameras, the Wi-Fi, the internet, those things I think you're going to see all come together at one time, all within the next 2 weeks. I'm hoping already. None of that will stop our ability to open and for people to come in and use the center. We are getting that center set up very much like Laurel Hill Community Center, using the same reception information, the same software. We are also working on some signage for that center to mimic Laurel Hill, with some plaques that are on the inside, doing some of work on the brick sign on the outside to turn that into the community center signage. So there's a lot of I wouldn't even say little things going on out there, but a lot of work that's going to come together, and then it's just going to be there, if that makes sense. So but most importantly, we want to get that date. So October 24th. I also want to say it's a busy week next week for Parks and Recreation. On the next day, on October 25th at 4 o'clock, we're going to have the ribbon cutting for Scotland Yard. So if people can get that on their calendar. And then October 26th, that night, is the Halloween in the park out at behind Scotland Yard. So I do have one thing with I. Johnson, trees at I. Johnson. We're also moving forward with getting the parking lot paved. The parking lot that we're going to pave that is going to serve the community center has 3 trees that are being recommended to be removed. So at the bottom, that tree certainly needs to be removed because it is sitting right in the middle of where the parking lot would be. If you're looking at that picture at the bottom, you're standing at the entrance to the community center, looking out towards Corona Street. So that's one tree. At the top, you will see the one on the right will affect the lighting that the city is putting up. They say if that tree remains there, then their lighting, of course, won't be as effective as if that tree comes down. And then on the left, those limbs will hang over the parking lot and where people would drive. Like if trash trucks come in, different larger vehicles, it would scrape, those limbs would scrape the top of those vehicles. So wanted to get your thoughts. Those are big, beautiful trees. Of course, have been there for many, many years.
Unless you can find a better reasoning, the one at the top would probably need to stay. On the left.
Where it says limbs will
Yeah.
overhang.
Yeah.
And I was wondering if we could
Cut it back, maybe.
cut it back.
Yeah, they can trim it back.
Yeah. The rest of them, I don't think are an issue.
What purpose of that tree serve? Nobody sits under for shade.
None to me, but to those people who attended there, they've made it known at various functions, there's a lot of history tied to it.
They've told you they want that tree removed.
Yeah, just trim it back.
That's all you gotta do, just trim it back.
We'll
It needs to be trimmed anyway.
we'll look at that. And so what I'm hearing is the bottom tree and the one in the picture on the right, we need to go ahead and take out. And of course, if we want to plant, I know it's not the same significance, but if we want to plant more, we can plant more trees out there. Last issue for discussion with I. Johnson is the parking lot, of course, what I'm talking about. So we're getting quotes to pave the parking lot we need for the community center, but of course, there's discussions about going around back to where that annex building is. That may eventually be deeded over to Southeastern. Do we want to pave that now or leave that?
I would leave it.
Leave it.
Leave
I'd
it.
leave it.
Okay.
I don't think
Okay.
it's if we deed it to them. I think it's when and
Leave it.
why.
They'll leave it
If
paved.
they need it done, they can do it.
Okay. That's, unless there's questions about I. Johnson, that's all I have for that.
Thank you.
Thank you, ma'am. I want to go back on item 4 was a discussion y'all had when I wasn't here that past Monday night, and I was supposed to have that discussion on the John Blue House update. And I think because I was watching it from Duke when you were doing that, I was watching it, but it got a little confused with the grant because the grant has absolutely nothing to do with this $100,000. The grant is in a separate room. It has nothing to do with it. The grant is going to look at taking care of the foundation. And it's probably not going to cover all that, but historic properties has some funds that they make it cover the difference of that. That's a different topic. What we're talking about now is the outside of the exterior of that house, the porches, the rails, the post, which I think Mike went out and put some supports on that to keep it from falling, because yes, it is getting that close to falling. And I don't think, I think Carol said it best at the historic property. She don't want to be sitting on that board or any board when that thing falls down. And I don't think I do either, because that is the hood ornament of the county. We have a quote, $281,000 plus some contingencies, which will probably be used up. So you might as well say 300,000 to get it repaired, the entire outside of the house. Inside of the house is okay. The outside's what's going to be the problem. So that's all the porch, the posts, the railings, painting the entire thing all the way around the house to get it back to where we can get that house back open. You know, we know there's a bid process, or an informal bid process, am I calling that right? That will have to take place, and we do have one, and we're working on another one. But so the request was, we had 150,000 we had already done from ARPA whenever we did that last year, I think. We just got 50,000, and we may not have physically gotten it, but we got a 50,000 from the state. So we're holding $200,000 now, and we would need another 100,000 to finish that, to go ahead and get that finished.
Now, Tim, is that just for the porches? Is that,
That's porches all the way around, upstairs and downstairs.
and it's gonna cost that much just to do?
Well, and the painting too. They're going to paint the whole house.
What about
So-
the lumber? The painting, I know I was on the board and we painted it, and in 4 years, it had almost turned gray. Then it was painted again. They put vinyl on it. It was 5,000 the first time and 13,000 the second time. Those boards gonna be changed.
Yes.
They're gonna be changed.
Yes.
you say that?
They're not going back with the original because, number one, you can't get it. It did talk to,
Something different.
yes, but we did talk to him about a vinyl or a faux wood type product. He said it would be too much for that to
But they need to
cost
be
too much.
replaced.
So you're going back with treated lumber?
Yeah.
It's 300.
But it's not going to be cypress, which is what it is now, right, Leon? It's cypress now. It won't be cypress, which is I think part of the problem. So
This 300 is gonna cover the exterior.
300 is going to get the house where you can open it back up
How
and
many,
get in
how many quotes have we got on that?
one so far. That's why we're working on getting another one. Finding somebody able and willing, licensed and insured to do this has been a task also. So not a lot of people standing in line to do that kind of work, or can do that kind of work. So the one we have right now is local, though, I will say that. So with that, unless there's any other questions, I will make the motion that we allocate another $100,000 to historic properties for the repairs of that house.
We have it in opera. We have not funds. We have it in art funds.
Yeah, we've got it in art fund. I mean, it's been dedicated as to general, and I don't want to get into that whole thing, but yes, we can. And if all else fails, we can pull it out of the general or the fund balance. Another topic, Representative Pierce said there's money left in the state budget, and we probably could get it from that, but I don't want to.
Guaranteed.
No, I didn't get it in writing. He wouldn't sign a paper, but if it does, we can replenish.
Mr. Chair, I'll second your motion.
Okay.
Before,
Hold on, we got a question.
I just want to second.
Okay. Well, I'll do that, and I'll amend the motion to say not to exceed 100,000. So if it comes in lower, then we're okay with that. If you're okay with amending your second.
BJ.
Now for discussion. Yeah.
He's got.
so if we go through this tonight, what is your expectation on the date of the?
Well, it depends on the second, when we get another quote, which I hopefully won't be too long. But the discussion with the guy with the first quote said he could be starting in November with it. So middle of November. So
How long they plan for it to take?
I didn't get into that, but I would think it would take 3 or 4 months at
Yeah.
least. At least,
Weather permitting.
weather permitting. All right, we have a motion and a second. Any other discussion? All in favor? Aye. Any opposed? All right, thank you. All right, moving right along to our opioid town hall. We are going to invite Miss Elizabeth Brewington from the North Carolina Association of County Commissioners to come. I think we gave some guidelines of some things we wanted to talk about, and we will turn this over to you.
Thank you so much for having me. I'm gonna. No worries. There we go. Perfect. So I'm with the North Carolina Association of County Commissioners, and I'm on their opioid settlement technical assistance team. And the goal of our team is to improve the health of North Carolina counties and assist and support counties in the planning for and talking about the opioid settlement funds. Next one. So statewide, 11 North Carolinians a day die to an unintentional medication or drug overdose. From 2000 to 2022, from provisional data from the North Carolina Department of Health and Human Services, more than 36,000 North Carolinians have lost their lives to an overdose. So these are our friends, our neighbors, our family members, and this is really sad context for the fact that we have these opioid settlement funds. Next. So over time, overdose deaths in Scotland County are also rising, similar to the state numbers. Next. And so we have the national opioid settlements. These are lawsuits with the manufacturers, distributors, and pharmacies that distributed these opioid pills. And so there are a number of different companies that were involved in these lawsuits, and several more are coming online as well. But so far to date, we have $1.5 billion coming to North Carolina over the next 18 years. North Carolina is unique in that 85% of those funds are going directly to local governments. No other state in the country has that split. Next. So the guiding principles for these funds are to spend the money to save lives, to use evidence to guide spending, to invest in the prevention of the root causes of the overdose crisis, focus on equity and a transparent and accountable process. Next. So as I mentioned, 85% of the funds go directly to local governments and 15% go to the General Assembly. So Scotland County will be receiving over the next 18 years about $5 million. And so if you're interested in learning about when the money will come into Scotland County, there is the North Carolina Opioid Settlement.org website, which is the home for all things opioid settlement. And there's a payment dashboard, and that will be updated regularly when new payments come in, and you'll know kind of when the payments will about hit the bank accounts. So the North Carolina Memorandum of Agreement is what guides the opioid settlement spending, and it is a legal document. And so I like to kind of translate the Exhibit A and Exhibit B of the Memorandum of Agreement into Option A or Option B. So the first option, Option A, is a list of 12 high-impact strategies that local governments can start investing in at any time. Option B, or Exhibit B, is a longer, much more expansive list of options, but counties must go through a collaborative strategic planning process that is outlined in Exhibit C, which is a very step-by-step process to unlock all the options in Option B. The idea behind this is Exhibit A, or Option A, is very much thinking and targeting people the closest impacted to the overdose crisis today, whereas Option B is more of the ripple effects, the community engagement piece. So I'm going to briefly touch on all the Option A strategies and kind of highlight some strategies you might be interested in here in Scotland County. And so this is the list. Next. So the first is collaborative strategic planning. We really encourage all counties to think about planning because these funds will be coming in over the next 18 years. This is very unusual. This is not like a grant. You have a lot of time to plan, and the reality of the situation in the overdose crisis is going to change, hopefully, in the next 18 years. So this is just a different way for counties to invest in thinking about how to use the funds. So the next strategy is evidence-based addiction treatment, and this is specifically following the American Society of Addiction Medicine's definition of addiction treatment, which is medications for opioid use disorder. It's estimated that about 10 to 20% of people with an opioid use disorder are receiving any treatment at all. And so the goal of this strategy is to expand access to this medication so anybody can get it anywhere. Medications for opioid use disorder are shown to improve patient survival, decrease overdose, improve withdrawal symptoms, and the transmission of communicable diseases. The three medications for opioid use disorder are methadone, buprenorphine, and naltrexone. So strategies 3, 4, and 5 are focused on recovery support services, employment services, and housing. And so really it's how can we connect people back into care, but also make sure we are kind of following the Maslow's hierarchy of needs. How are we making sure people have shelter and safe and stable housing so they can kind of clear their mind and start to think about what are the next positive steps they could take? What are the ways they can get employment and start having connections back into community? And then how can we make sure that they are able to have friends and a sense of connection and belonging? So strategy 4 is recovery housing. And so what is very unique about this is that you could use it to build a house, but you can also use it to keep people in the houses they are already in. So emergency rent deposits, utilities assistance, et cetera. And we're really encouraging counties and local governments to think about housing first, which is offering unconditional permanent housing to people so they can start getting their life back on track. Strategy number 5 is employment-related services. So how can we get people into jobs once they're in recovery? We have a really amazing resource in North Carolina called Recovery Friendly NC that helps businesses and local governments really get into hiring people who are in recovery. We're also encouraging local governments to consider fair chance hiring ordinances. These are laws that are kind of known as ban the box. It's making sure that you delay asking somebody about their criminal record so they can then explain their history in an interview. And fair chance hiring policies are known to boost income and sales tax. So number 6 on the option A strategy list is very specifically defined as early intervention, and it's helping kids who are already showing signs of struggle. We know that trauma is often the gateway drug and that kids' drug use doesn't show up first. It's a mental health concern. So how can we train the adults around the kids to recognize when a kid is having mental health problems and make sure we can wrap those kids up with love and support so the drug use doesn't happen? So wrapping people up in love and support and care to increase the likelihood that they won't have an adverse childhood experience or trauma. Strategy 7 is focused on naloxone distribution. So naloxone is the medication for reversing an opioid overdose. And so it is associated with a 50% drop in overdose fatalities. And so we want to increase access to this medication anywhere and everywhere that people can find it. Strategy 8 is known as a post-overdose response team or a quick response team. We see this most successfully with an EMS or a community paramedic paired with a person with lived experience, a harm reductionist, a peer support specialist, going out and following up with somebody in the key hours of 24 to 72 hours after an overdose and connecting them with resources. Strategy 9 is a syringe service program. These were legalized in North Carolina in 2016. And according to the CDC, people who participate in a syringe service program are 5 to 7 times more likely to enter into treatment, and they're cost effective. A 10-cent syringe prevents a $400,000 bill for endocarditis or HIV or Hep C treatment. We have a great resource in North Carolina called the North Carolina Safer Syringe Initiative, which is run out of the Department of Health and Human Services. And so when the law was passed in North Carolina, it required syringe service programs to have those core services at the top of the slide, such as educational materials, secure disposal, naloxone kits. But really, syringe service programs offer a much wider array of services to people in the community and are often the first trusting contact that people have. And this is the North Carolina Safer Syringe Initiative I mentioned earlier. And syringe service programs are currently serving about 63 counties in North Carolina. So strategies 10, 11, and 12 are focused on incarcerated people. So strategy 10 is criminal diversion programs. So how can we focus on programs that provide an alternative to incarceration? Because currently our jails our most common mental health treatment provider, and I'm sure they don't want that job, even though it has become their job. So these programs are focused on pre-arrest programs such as law enforcement assisted diversion programs, which provide people a way to think about, do they want to get into treatment and make a positive step instead of going through the carceral system. The reason this is so important is there was a study out of UNC several years ago that found that people leaving jails are 50 times likely to die the first 2 weeks after release. And so it is really important that we are making sure that our most vulnerable population is being taken care of. Strategy 11 is medications for opioid use disorder in jails. So very similar to strategy 2, this is the American Society of Addiction Medicine's definition, and it is trying to provide those 3 medications in our jails. And in 2022, the US Department of Justice issued a guidance saying that jails that do not continue an inmate's medication for opioid use disorder or change it could be in violation of the Americans with Disabilities Act. And so we just are kind of telling everybody about this and that the opioid settlement funds could be used for providing medications for opioid use disorder in jail. And finally, strategy 12 is focused on reentry. So how can we connect people back into the community, provide them employment, housing, support after they're coming out of incarceration? So just a plug for my team, there are 4 of us, and we provide supportive technical assistance such as strategic action planning, collaboration, peer learning between counties, and helping implement programs with opioid settlement funds. And so these are just some of the resources I mentioned throughout the PowerPoint. The first one is the ncopioidsettlement.org, where you can find a lot of dashboards and information about the settlements. The North Carolina Department of Justice's website, where you want to find the memorandum of agreement, or if you have any FAQs about it. My organization, the North Carolina Association of County Commissioners, and then North Carolina Department of Health and Human Services, which is where I got a bunch of the data for this presentation. And then one last plug, if you're interested in how other counties are spending the funds, we have a local spending authorization dashboard. And so this is on ncopioidsettlement.org. And these are counties that have said, I intend to spend the funds this way. And you can see and click on and read their plans and just kind of see what's most popular. Currently, most people are choosing option A, and I would say the majority of those people are doing collaborative strategic planning and thinking deeply about how to use the funds. And I'm happy to take any questions.
Could you go back to that. I want to start my question first because I have to leave. And so fellow commissioners, forgive me, but I do have to step out in a moment. You gave us a lot of quick information.
I did.
And one of my first questions is, as the money is being funneled through the county, Are we allowed to mix and match under these 12, or do we have to pick one in particular and go forth?
You are allowed to pick as many as you want. The only caveat is then you need to report on each one you pick. So every year, the county is required to do an annual financial report and an annual impact report, going to that transparency and accountability piece. And so with that, you would just need to report on every strategy you fund.
My second question is, I know you say that we're going to get $5 million over the course of 18 years.
Mhm.
I don't know if you brought that number with you of where we stand, or if you have it, Ms. Nee, but I don't want, or if Beth has it, but I don't want our citizens to leave thinking that that 5 million is coming immediately. But I also want them to know that it starts getting smaller as the years progress. Can somebody kind of shed some light on that for the public? What those
That-
numbers look like?
So right now we have in our account per se have about 500,000, 523,000. And so you're exactly right. The biggest installments came or come in the first year, and then it's going to get smaller and smaller as these 18 years go. So
You'll actually get a big jump this year because the Walmarts of the world are going to be paying out, because the Walmarts of the world can pay out all 18 years in one go.
And we haven't gotten that.
And that hasn't come in yet. They're expecting early 2024 for that to come in.
Do we
But
have an idea on what that is?
this website, let's see, will give you an estimate about how much it will be.
are you saying that's not included in that 5.2 right there that Scotland County's getting? This is going to be additional?
No, the Walmart's factored into the 5.2. There's still like a Kroger and a Rite Aid settlement that are being finalized, that maybe some additional funds will be coming. That's not factored in. Purdue, for example, has not been settled either. So there could be more coming. We just don't know that yet because they're still tied up in court.
I got you. And Rite Aid just filed bankruptcy, so.
Yeah, it is always a changing landscape.
Commissioner Williams, can I ask one more question? Then I'm leaving. So in my mind, as we've been having these meetings leading up to this, perhaps the easiest thing for us to do when you think about reporting and all those things, we have county agencies that are here, DSS, Health Department, EMS, the jail, who could very easily get some of this money to help do those things. But we also have other substance abuse programs in the community, and I see some of them here. And in my mind, I'm thinking some of our departments are already full. I mean, they're overworked. So it would help possibly to work with some of our community agencies. But I want to hear from you. What are you seeing across the state or hearing as it relates to these funds being used in either or both of those ways?
I'm definitely seeing a mix. I'm seeing some counties do like a request for proposal process to really engage the local community. They would I've seen it done two ways. One, the county picks, say, 3 strategies and says, this is what we're going to focus on. We're going to put an RFP out. And if you focus on these strategies, you can apply. Or I'm seeing some counties say, we've got robust programs. They could do a lot more if we hired one more person or if we expanded our hours. And then they use the funds to kind of supplement that. It's totally different depending on the county. And also depending on how much funds they're getting.
Okay, thank you.
One for April. You did say that number was 523,000
That we have right now.
That's what we have now.
Yeah.
But
Scroll
it's
down.
fair to say that's going to drop off to somewhere in the neighborhood of $25,000-$30,000 for the remainder of the years.
Yeah, this lovely graph will come up in a second. What they did is they front loaded all the payments in the first 3 years, and then it decreases a little bit, and then it decreases a little bit. And so you do not have to spend the funds in the years in which you receive them. And you can also kind of figure out if you want to do a consistent spend every year. Because as you can see on that graph, on year 18, you'll probably get $127,000.
More than I thought.
It's pretty decent up till
For a while.
Yeah.
Up until
37, 38.
yeah.
I'll be sold in.
Yeah.
And most of y'all won't be around it.
That was that was my question.
Hey,
The other
That's
question,
out of order.
the other question is, can you put your email address up to our local providers can reach you if they got any questions? I'm pretty sure that some of them gonna be inquiring about this money.
Yes, it's,
Help improve our community with their services they provide. So pretty sure they will be reaching out to you, some of our local providers.
yeah, happy to. It's opioid settlement at ncacc.org.
We're not open to the floor, actually.
Yeah, the floor is open. Well, oh, for us right now, and then we'll get, yes, sir.
Just seemed to me that for the commissioners, we would ask our manager to get with the providers, everybody, can't provide this, but I know there are a certain number of folk that can provide our services. It seemed to me that we should ask April to come back to us with a recommendation of our health department, the hospital, or whomever. And then we go from there. Because the general public who handles this, the money comes to Garland County Commissioners. So I think it starts with us, and then they will come to us once we decide on
How we want to use it.
how we want to do it.
Right.
I agree with John on that.
Well, and that's been the purpose of the opioid committee meeting that we held a couple of weeks ago. And I guess another one is scheduled. This is to bring everybody in a room and try to say, because the tricky part of this is that money fluctuating every year. And, we have 500,000 this year, but next year we're only going to have 300,000 or whatever the number is. And if you get into a long-term commitment, the money may not be there 10 years from now to continue doing whatever. Because there was a time of talk, and this has been many meetings ago, about a joint between Richmond County and Anson and us, and putting a center in Richmond County and funding it through that. But that's kind of failed away.
Seem like with this information, it's just not
yeah.
viable.
Well, let me ask you a question, and I'm not going to mention the county, because we had a discussion at the association meeting in Raleigh, or I had a discussion with the county, and I said, what are you doing with your opioid money? I said, we gave it all to the judge. Now, that sounds simple, but I said, expand on that. What do you mean? He said, well, it's basically drug court, and the judge decides, okay, I'm going to pay for your treatment for 6 months, or I'm going to pay for your housing. If you go get treatment, you get back, I'm going to pay you housing for 6 months, or I'm going to get you into a job program or what. And it's done through those funds. Is that working, or do you know which one I'm talking about?
that is going through the option B report to be able to do that. And that is that collaborative strategic planning process you have to go through, and you have to re-up it every 4 years.
It's like chasing the horse. That's like chasing the horse to me. That's after he's in court. After he's
that's all after the fact. Yes, I get.
I'm saying, what are we gonna do on the front end?
Right.
To get
No, I get you. I would just want to know if she had heard of any success out of that.
Well, now let me ask you. Now you working with other counties also. Yeah, if you need to ask the question, you go ahead.
No, y'all aren't voting after I leave, are you?
No.
All right. You go.
Ask the question before you leave.
No, I'm good. As long as y'all ain't voting, I'm good.
Except for on your stipend decrease. So.
So you're working with other counties, and what kind of success have you seen with other counties?
Honestly, every county is in a bit of a different kind of stage. Some have kind of had task force for a while, and so they jumped on the funds and they've kind of invested in programs that they were already had. Some did a request for proposal that's been pretty successful. What specifically success story would you like? Like,
Something
kind
that works. That's lowering the opioid use. That's really helping the people, because the way I see this, now we got 18 years to do this, the money decreases, but if we use this money right, then so would the opioid usage would decrease.
mhm.
Well,
So-
and we got Robert Sampson here that
So and that's what I'm saying. you know, we got one shot at this thing. We need to make it right.
Right.
You know,
One,
if we do it
one
right,
chance to
the
use
opioid-
it. Yeah.
The opioid would
Jason,
decrease
let's
right with
take
the
that
funds.
mic and put it.
Yeah.
So that's what I'm
stands so
asking. Have you
somebody
seen
comes up
any of
and
that?
she can
You know,
answer
where
it.
there's a decrease in opioid use
Whit's
in
not-
other counties?
Whit's not here.
I agree with you, Bo. We got EMS director. He can tell you some of the hot spots where they respond to overdoses and what area.
No, I'm talking about in other counties. I'm talking about in other counties. Has she seen any
It's hard to say because
in other counties other than this county?
yeah, it's hard to say because the data is on like a year delay. We're just now getting the 2022 data.
Uh-huh.
And the funds have only been active for a year. And so we're just now kind of starting to see impact.
What kind of impact have you seen?
I've seen
Programs.
pretty good success rates with post overdose response teams, and that they're connecting people to treatment. Getting people on a medication assisted treatment has been really big.
What about local providers?
It's been a partnership with local providers.
Successful?
I've seen pretty good success rate with naloxone distribution. Different counties are doing different things. Some are investing in naloxone vending machines. Some are investing in like community response programs that hand it out. It kind of depends on your definition of success.
Well, just decreasing.
It's decreasing overdose deaths. Yes.
But it doesn't decrease the usage. I'm throwing that in there because
That's a very tricky topic in
I
the
had a
age of fentanyl.
I had a couple discussions with my personal doctors in the last week, and I won't mention their names because their boss is sitting over here. But no, it wasn't bad, but that was one of the things that they both said they didn't think would help because it's almost an enabling. It's not, because they hear the stories of they give the naloxone to their friend and say, all right, if you see me quit breathing, give me this. And then they just go on and do it again, and I won't get into this whole conversation that we had about it, but that was because I brought that up. I brought up about the naloxone or whatever, if I said that right. But and that was their opinion on it was.
I completely get that. I guess from my perspective, the only person who can't recover is a dead person. And so if I can give somebody as many chances at life as possible, I would rather
I get it.
do that. And so I completely get the point. I think what's amazing about that medication is it only restores breathing. That is the only job of that medication, is to make sure somebody breathes.
Right.
I saw your hand earlier.
So, yeah, let's open it up to the floor. If you want to come up and state your name, you have to do it over here because the folks watching online can't hear you if you're not at this mic over here. So, we'll limit it up to 3 minutes, and like we normally do. But
Loretta McNeil, my quick question is basically, do they have to be locked in to the selections that they make? Because it seems to me somewhat like Mr. Commissioner Frizzell put out, that if you see an improvement, whatever the success story would be for this area, because every area differs. And EMS is important because EMS knows the numbers.
Yeah.
So therefore, can they be flexible and change to different categories?
Yes, so you can switch strategies at any time. We're actually seeing a couple counties who will do like a request for proposal process with their local providers with the goal of training that local provider up, building capacity so they don't have to use opioid settlement funds. You can change strategies within option A at any time. So counties have to do the local spending authorization, which says this is what I want to spend funds on. But you also have to do a budget amendment just to satisfy North Carolina state law. And because that budget amendment is on an annual basis, you could change at any time.
all right, I know somebody else has got a question or something they want to say about it, or offer a solution, or what do you think on those categories, or even the option B if there's something different. I mean,
Do you have any idea on how many people or how many counties, I'm sorry, are using it for education and young people?
So for kind of primary prevention, educating schools, I would say that is an option B strategy. And I only know of 2 counties that have like submitted their local spending authorization doing that. I believe another couple are in the planning processes just because they have to go through all the steps in Exhibit C first. So just a handful right now.
You know what kind of luck they having with it so far, or too early to tell?
Too early to tell. September 27th was the due date for all the first year annual financial reports and annual impact reports. And so we're just now starting to comb through that data. All 117 local governments had to submit something. So
I understand. I just,
I'm hoping to have, what will happen is hopefully in the beginning of the new year, we'll have new dashboards where you can see all 117 local governments' annual financial reports and their impact reports.
Yeah.
They'll be
That
on
would
this
be-
website as well.
that would be very interesting to look at. Yes, sir.
I would like to know how many agencies represented here tonight is providing these type services now, not for opioid, but the same people. How many agencies are here tonight represented
Substance.
that are providing these services now?
1, 2, 3,
Okay,
6, 7.
very good.
Come on up.
Thank you. That's what we need.
Yes, my name is Terrence Williams. One of the things that I found out for providers is that we have a lot of these individuals that are undershored. And even though the state are providing funds for that, but they are at a competing, competing rate. Is there an opportunity for these funds to be used to undergird and service that population?
Yes, the funds can be used for that.
Gotcha.
The only
Ask you if you would come up. And
Yeah.
say-
The only caveat I will add is because this is the national opioid settlements, it has to be somebody with opioid use disorder first and then co-occurring mental health concerns.
Hi, Commissioners. My name is David Pope. I'm currently the Chief Operating Officer at Scotland Healthcare System. As of December 1st, I'll be taking over as the Chief Executive Officer. We have been one of the partners that have been attending the regularly occurring task force meetings where there's been a lot of good discussion already to this point. A couple things that I would encourage you to think about, even though you've got a wide range of options to choose from. The first thing to consider is that if you go with option A, some combination of those, I think 12 different items, then it's very clear what we would need to do to report and ensure compliance. I'm of the mindset that when the government tells you this is a report card, you do it this way and turn in these reports, it's a lot easier than having to create something from whole cloth. So I would be in favor of us choosing some combination of those option A options. Secondly, I would just urge you to consider that you already have committed community stakeholders that are addressing this challenge. Okay, so it's not something new. This problem obviously exists. It's existed for a long time. You've got folks from the law enforcement, EMS, healthcare, DSS. I'm leaving out, I'm sure, other folks, the folks that have been on this task force that currently are trying to address this, but we're doing it in a way where it's very much underfunded. One of the things that's come up during those task force meetings has been the fact that there are lots of services out there and available, but there's not really somebody in the middle that is helping to tie and to coordinate and to navigate all those services for people that need them. I think back to the model of COVID, right? So it's a global pandemic, but in terms of being able to address the challenges that we found here in this community, it was the folks locally that had to band together and figure out, okay, what is the answer? And I was really, really proud of this entire community's response to that and the success that we had. And finally, I would just urge you to consider what are the long-term sustainable solutions. So when you look at this chart, $500,000 is a lot of money. But if you're talking about something that is going to be sustainable over 18 years to where it dips down to $127,000, and you start figuring in cost of staff that might be involved, cost of supplies and capital, that's something where $127,000 to be able to do a program addressing this challenge is really not that much. It goes quickly. So I would just urge you to consider that we've got local solutions that can be tailored particularly for us and for this community, involving the stakeholders that are here, the stakeholders that have been part of the task force. But I would just urge you, don't leave out the good work that's already being done that really just needs more funding. Thank you.
Can I ask you a question?
Yes, sir.
And you may not know the answer to this, and this is okay. And we talked about the deaths in Scotland County. I think there was one this past Saturday night or Sunday morning,
Right.
another one of a young lady. But my question, if they bring, and I'll use myself, they bring me in and I'm an overdose. They bring me in an ambulance into the ER and you get me breathing, you get me back to normal. What do you do? I mean, they just leave, or is there some follow up, or could there be some? That I guess that's when it could go to a task force or an overdose task force.
So as a general rule, when patients come into the ED for this or any other sort of incident or situation, if they're not admitted and they're discharged back into the community, then when they're discharged, they're given information and contacts. If it's something's appropriate, then follow-up appointments are made. I think, Commissioner Ivy, you've hit on it, I think, before, but one of the difficulties is that a lot of times folks that have this particular disease, this addiction, are folks that may not at that point choose voluntarily to follow up on those supportive services. And that's one of the reasons that we think, for example, with the option number 8, right, which is a post-overdose response, that's a good way that somebody can start being that connection from the services that already exist back to the patient. Same thing with those reentry programs, number 12, the recovery support 3, the early intervention. So there's a lot of things that if you had someone who was more of a navigator, making the connections with the services that exist and trying to get those folks into those services.
So basically a person or department that does nothing but coordinate that from a wide angle.
I think it would be helpful almost to have somebody that, if you want to call them an air traffic controller, if you want to call them dispatch, somebody that's able to know what are the services that are available and how do I get the individual folks connected to those services and follow up.
Some counties are calling that like a linkage to care specialist or a peer navigator, things like that.
And you could, and again, I'm thinking out loud, but you could even, once that person got somebody to a certain program, could offer assistance with that financially if they needed it, if they didn't have insurance, or if they were about to lose their house or that kind of thing. I mean, I'm thinking out loud.
That's very similar to our reentry program, but the reentry program is for a different population. But we take those people and we link them to services, and then we have some financial supports for them. So.
Okay, who else? Anybody else? Mr. Samuda?
Good evening, everyone. My name is Kenneth Samuda. My organization is Emmanuel Sons and Daughters of Promise. It is a nonprofit organization, and we deal with people who suffer with addiction. I've stood before the board on several occasions, and my question to you is, well, first let me say this. My experience with people who have addiction goes 30 years because I was one time an addict. July of next year, I'll be 18 years clean. I brought with me today one of my partners, my CEO, Dr. Darryl McAllister. He's been in the business over 30 years. So he has all the administrative experience needed to provide the services that so many of our citizens are not yet receiving. I also invited my COO, but he had an emergency at the last minute and he wasn't able to make it. But with all the experience that I bring to the table, I believe that an inpatient facility would do a lot more good. I say that because outpatient people come in and they stay 4 hours. And then they go back into the situation that caused the problem in the first place. So it's a revolving door. That's why the numbers are so bad. We need to pull them out of their situation and put them someplace safe where they can learn the tools to become drug-free, to become independent. My question to you is there money allocated for inpatient treatment? And how do I go about getting that?
So money can be used for inpatient treatment. It totally depends on how the commissioners want to fund the strategies. Some counties have been doing like the request for proposal that I mentioned that you could apply to use the funds for that way.
And the way that works, and I won't get into the minutia of that, but the way that would work, correct me if I'm wrong, April, an RFP would be, you would say, if it's a qualified person, and we can talk about that later, then we would pay X amount of dollars for the treatment for that person, or would,
Right. As I'm sitting here thinking through that, if the commissioners decided, okay, we're going to focus on treatment, I'm hearing you say we could decide we're focusing on treatment and we're going to put an RFP out to find a qualified provider that could provide that treatment. And then a stipend may come with each participant that's referred.
And
Is
my
that
team
right?
has a RFP guide that's about to come out with sample application, scoring rubric, things like that. So we could help you craft that.
That'd help.
Yes.
Okay, thank you.
I have a
Thank
question.
Sure.
Other than a hospital setting, what other places, because that's a great idea to give them more than 4 hours treatment.
Mhm.
What facility would you have that's professionally staffed that could keep them for 2 weeks or a month?
Right now, I came here tonight expecting to ask for money to build a facility outside of the city limits. Now, if there is a building outside of the city limits that is not too condemned, we could use the money to restore that building. I have a large staff ready and willing to do the work, very experienced to do the work. I myself am a substance abuse counselor. We're ready to do the work. We just need a place to put all of our experience in one place so that we can actually help people who are struggling with addiction. So I come before you yet again asking, what do you need from me so that you will feel comfortable allocating that money towards Emmanuel Sons and Daughters of Promise? We are registered by the state of North Carolina as a nonprofit. So it's not like, it's a fly by night. We've been in business now since 2013.
Where are you currently located?
Well, that's the thing right now.
No, I'm saying you've been in business since.
Well, the organization has been alive since 2013.
Okay.
But every time I come forward to try to get money or to write grants, to get a facility where we can operate, I'm turned down. So I don't know what else I need to do because, as I said, I have all the experience around me. I have people willing to do the work. What more do y'all need from me so that I can get what I need from you guys so that we can provide the service?
well, I think it, and I don't want to speak for everybody yet, but that RFP process is probably going to be the way to go if we do that. I'm not saying we do that. I'm just saying that would be the way. It would be the way to manage it because we got to manage it with the state. We got to say, hey, this money's going here and this is exactly what it's being used for. As anything, we don't ever get money without strings hanging off from it. So, and this money seems to have more strings than anything else we've gotten. So,
and see, one other thing about this program, if it's a successful program, it's self-sustaining. So it's not like I'll be coming back every year or every 2 years asking you for more money. The program will sustain itself.
okay. Thank you, sir.
Okay.
Yep. Appreciate it. All right. Anybody else? Anything? I mean, it's the door's open. When is our next meeting?
So our next meeting is November 20th at 2:00.
Is that on our calendar?
Yes. That is, I believe they're the third Monday of every month at 2:00. they're scheduled like that.
Okay, so November the 20th is our next task force. And I don't think we need to wait till then to start doing stuff. If, between now and the first of the month, if we can come up with some stuff and we can talk about
We'll
that.
be back here on November 6th. I believe that's your next commissioners meeting.
Right.
April, can you collaborate? I'm sorry, what your name?
Elizabeth.
With Miss Elizabeth, with other counties, how they're approaching their providers?
Oh, absolutely. And I'm familiar with the site that she is referencing and where you can go look at other counties' plans. So we can take a look at some of those.
Okay. All right. Without any further, I will thank you. Yes, sir. Oh, I'm sorry. Well, I'm not going to close yet. So yeah. No, I won't. No, look, I'm gonna write it down. Raffle. If I start to close, somebody say raffle. Right now we'll open it up to commissioner comments. Duke, you have anything else? John? Brazil. Couple things. Thursday night is our Lumber River Cog dinner. If you wish to attend, let Jason know. He can get you registered. It is a 50 themes. It's not a dress up suit and tie like they normally do. It's a 50s theme party. I don't want to use that, but that's the word. That is Thursday night at the Lumber at the what's the name of that where the agriculture center is in Lumberton. Yeah. So let him know. The social starts at 5:30.
You said 50s theme?
It's 50s theme. Yeah.
I guess I'm the only one.
You probably got stuff in the closet. I didn't say that, John.
We let y'all have that.
I've been told my wife bought me a shirt and I don't know what it is. So, but I'm have to wear it. The other thing is about the microphone service. With me watching this from Duke last time, it was excellent, with the exception of the folks that have it too far away. It's hard to hear you, and it's not intentional.
Thank you.
It's just the way you talk, but I think you need it closer. But other than that, you could hear it really well online. So yeah, we'll get you there. With that said, if nobody else has anything, we'll do a raffle. See, you thought I was gonna.
Tim, let's do a raffle.
Yeah. That's it. Where they put their names in the basket out there to win. Jason's got some prizes. And feel free. I guess the food's still set up out there. To fill yourself up before you go.
Hey.
Leon, you might win. You better not leave.
Shake it up.
We got 2 gift certificates, $25 gift certificates for the Chamber of Commerce.
Let Lombard Exchange pull it.
We will let Miss Sinclair do one.
That's Shirley Campbell.
Shirley. I didn't even know she was here.
Shirley. You bring it.
I got it. Congratulations.
I didn't even know you were here.
And Sandy, you can do the next one.
Sandy, reach in there and do right.
Make sure you tell it on the radio that way.
Oh, he done got one ball up, maybe.
Valence Jackson.
All right.
Thank you.
All right, there you go. Thank you for all coming. And I think there are plenty of food remaining out there. So help yourself. And with that, we'll adjourn this meeting. Yeah, I need a motion. I need a motion for that.
Motion.
Motion and a second. All in favor? All right. Any opposed? We're adjourned.
Not quite sure yet.
Yes, sir. Thank you so much. I appreciate it.
All right. No, let me
Yes, sir.